Welcome to The Growing Dentist by Dr. Ali. In this video we will be discussing about bad breath, which is also known as halitosis. Halitosis is a term used to describe noticeably unpleasant odors that is exhaled in breathing. The Latin word halitus means breath, while the Greek suffix osis is used to describe a medical condition, example, cirrhosis of the liver. It has a significant impact, personally and socially, on those who suffer from it or believe they do have halitophobia. It is estimated to be the third most frequent reason for seeking dental aid, following tooth decay and periodontal disease. Tongue is the most common location for mouth-related halitosis. The tongue bacteria produces malodorous compounds and fatty acids, which causes bad breath. There are over 600 types of bacteria found in the average mouth. Several dozen of these can produce high levels of foul odors, mainly due to the breakdown of proteins into individual amino acids, followed by the further breakdown of certain amino acids to produce detectable foul gases. Plaque can build up on your dentures if you don't clean them regularly, putting you at risk for gum disease and bad breath. Pericardinitis can also be one of the reasons of bad breath. It is the inflammation of the gum tissue around your wisdom tooth. This can happen when a tooth is still partially impacted. Its symptoms range from mild to severe, and if left untreated, it can be dangerous. Dry socket is caused by the exposed bone in the socket being irritated and can result in a foul-smelling discharge from the mouth. Its symptoms include foul breath, severe pain, swelling, and an unpleasant taste in the mouth. Chronic periodontal disease and acute necrotizing ulcerative gingivitis also cause halitosis. Bacteria growing below the gum line, that is the subgingival dental plaque, may have a foul smell upon removal. The second major source of bad breath is the nose. Nasal odor may be due to sinus infections or foreign bodies. Postnasal drip is the type of mucus that tends to be rich with bacteria and substances for the bacteria to digest. In most cases, postnasal drip is a common cause of persistent and mysterious halitosis that lingers even after multiple teeth and tongue brushings. Pharyngitis is the inflammation of the mucous membranes of the oropharynx. In most cases, it is caused by an infection, either bacterial or viral. Other less common causes of pharyngitis include allergies, trauma, cancer, reflux, and certain toxins. It can cause concurrent sore throat and bad breath. Putrefaction from the tonsils is considered a minor cause of bad breath. Approximately 7% of the population suffer from small bits of calcified matter in tonsillar crypts called tonsilloliths. These crypts smell extremely foul when released, and can cause bad breath. The valve between the stomach and the esophagus may not close properly, allowing acid to enter the esophagus, and gases escape to the mouth, causing bad breath. Systemic diseases such as chronic liver failure, lower respiratory tract and renal infections can also become a major cause of a bad breath. It is very important to keep your body hydrated, as dehydration can also lead to halitosis. People who suffer from a highly exaggerated concern of having a bad breath are considered to have halitophobia. This phobia is also called delusion halitosis. Drugs such as paraldehyde, disulfiram, alcohol, and cytotoxic drugs also lead to bad breath. There are various methods to diagnose bad breath or halitosis. Halometer, a portable sulfide monitor used to test for levels of sulfur emissions, hydrogen sulfide in the mouth air. Gas chromatography is also helpful in diagnosis of a bad breath. Portable machines are currently being introduced. This technology is specifically designed to digitally measure molecular levels of the major sulfides causing bad breath. Banner test. This test is directed to find the salivary levels of an enzyme indicating the presence of certain halitosis-related bacteria. Beta-galactosidase test. Salivary levels of this enzyme were found to be correlated with oral malodor. The most important measurement of bad breath, which is the gold standard, it is the actual sniffing and scoring of the level and type of the odor carried out by trained experts. The level of odor is usually assessed on a 6-point intensity scale. Gently cleaning the tongue surface twice daily is the most effective way to keep bad breath in control. That can be achieved using a toothbrush, tongue cleaner or tongue brush, scraper to wipe off the bacterial biofilm, debris, and mucus. An inverted teaspoon may also do the job. Chewing gum is also helpful to get rid of a bad breath. Since dry mouth can increase bacterial buildup and cause or worsen bad breath, chewing sugar-less gum can help with the production of saliva, and thereby help to reduce bad breath. Maintaining proper oral hygiene, including daily tongue cleaning, brushing, flossing, and periodic visits to dentists and hygienists. Flossing is particularly important. Feel free to take any advice from the growing dentist team.
Thank you for watching this video. For questions or queries, kindly write us in the comment section below. And don't forget to like, share and subscribe our channel for more interesting videos of dentistry.